I don't know occupational therapy. Maybe we're not with therapy, I'm a therapy, or maybe you're just a therapist of therapist. I don't know if that makes sense. I'm just like thinking. Oh yeah.
Hi guys, welcome back to my channel. It's your favorite occupational therapist back again with another episode. If you're new on this channel, please make sure that you have subscribed, and please everyone like this video, share this video, comment, and make sure that you put on your bell notifications. And yeah, let's start with today's topic. Today's video basically doesn't have like a topic, but what I'm doing is I'm sharing assumptions that my followers have of what OT is and what OTs do. So a while back I did a questionnaire on my Instagram just asking people what do they think OTs do, and yeah, so I received responses, and I just want to share with you guys the responses that I received. And a lot of the responses that I also got were people saying that they don't know what OT is and they don't know what OTs do. You know, a lot of people like Angas, honestly, Angas, and it's okay. It really is okay. I'm here to try and change that. But yeah, so thank you for those that actually came through and told me that they actually don't know what OT is, because they did motivate this channel, and shout out to you guys. So yeah, I have written the responses down, so I'll be reading them, and yeah, let's get into it. Response number 1 said OTs recover basic living skills lost or hampered, and that is correct. And then the next one said OTs assist possibly disabled and injured individuals for them to recover lost ability of daily acts. And then this one said OTs treat ill or injured patients using everyday activities / exercises. And I just wanted to comment on this one to say that as occupational therapists, we are trained in using activities, right? We're not trained in using exercises to treat. It's the physios that are more trained in using exercises, and that's probably the difference between the two. Well, one of the differences. But yeah, we use activities to treat. However, we do use like exercise methods for like our warm-up sessions before the actual treatment session, and we also use exercises for our home programs, but we are not trained in using exercises. And then the next one said OTs help people learn how to do daily activities again after an injury or stroke. And I just want to say that we don't help people that are just injured or have suffered a stroke. We're not limited to that. We help literally anyone that has suffered a condition that has limited their ability to participate independently in their daily life activities. So if there's any disruption, like any negative disruption in your life, we can help with trying to regain back your ability to participate independently. And then this one said OTs lift others by helping patients re-enter. And I really liked this response because it looked at the core reason or the core goal of OT. And the core goal of OT is that patients are reintegrated or they re-enter back into community. And sometimes it happens that a person doesn't recover fully, so then they are reintegrated back into their home setting. And what we do sometimes is that we provide them with assistive devices, and assistive devices are basically any devices that can help an individual to be more independent. And one of the well-known assistive devices that we issue out are wheelchairs. So yeah, we issue out wheelchairs, and yeah, absolutely anything that is adaptable to help you be more independent. And yeah, we go into the home setting and we adapt to the home. We just make sure that a patient or an individual is independent as possible. Yeah, so yeah, and then the next person said OTs help improve damaged or ill people's skills so that they can live a normal life again, and that is correct. And then the famous response, someone also said OTs therapize occupationally. I laugh, but this is actually what everyone, this is the perception that everyone has of what OT is. And therapize occupationally has no meaning. What does it mean? It means nothing, you know. And yeah, a lot of people don't know what OT is. So we don't therapize occupationally. And then someone also responded and said OTs put casting if you have broken bones, which is also incorrect. We do not put casting when there's a broken bone, but what happens is normally you'll see the doctor and the doctor will put on the casting, and then after about 6 weeks you'll come back for a checkup, and then the doctor should refer you to either a physio or an OT, and that will depend on where your broken bone is. And then the OT or the physio will assess your joint range to see if there is any limitation in the range in your joints. If there is, then they continue to treat you, and if there isn't any joint limitation that could affect how you are participating in your daily life activities, then you are discharged, right? But I think what someone can mistaken casting for is splinting. So we do splinting. We splint, and basically splinting is a method of like immobilizing a joint or protecting a joint, or trying to improve the joint range. And it's basically like a plastic that you put in water and it melts, and once it has melted you then mold it onto the body part, and it will harden when it dries. And yeah, it's similar to casting, but it's not casting exactly. Yeah, so no, we don't. And then someone also responded and said OTs massage people. We don't massage people, and yeah, my family was also disappointed that I don't massage. But yeah, it's the reality. OTs don't massage. But what we do is that we use like massage techniques for individuals that have like scarring, that have suffered from burns, and we're trying to treat the scars. So we do use massage techniques for like keloids, and yeah, but that's literally about it. And maybe for desensitization we use like massage techniques, but we don't massage. And that is it. Oh, and then someone also said OTs work in mines, and yes, that is also correct. I think Sibu mentioned it in the previous video as well. Again, go watch that video. Yes, so we work in mines. So there we literally just assess if you are fit for work, if maybe something happened and you got injured, are you fit to return back to work. And yeah, we basically just assess and we treat. So we try and make sure that you are fit. If you're not, we try and look at ways to get you fit. We look at the components of the work that you do. What does your work require you to do, and we work on that. So yeah, we have come to the end of our video. I just want to say thank you for watching, and yeah, subscribe, like, share, comment, and put on your bell notifications. I will see you guys on the next episode. Thank you. Bye.